Hi, everybody. My name is Ashley Schmidt, and I'm a senior program manager with Macarize. Macarize is an AI company that is working to make health predictive everywhere. And we are comprised primarily of machine learning scientists and software engineers, and a few program managers like myself. And today I want to talk about how we are using AI technology to calculate capacity that health facilities have for care in Sierra Leone and how governments are using this to optimize resources, especially in relation to COVID-19. So again, we'll talk a little bit about Striata, the product that we've developed in Sierra Leone, and what those AI insights are. And I'll give you a couple examples of those throughout the slides. And then we'll conclude with a bigger thought about how this tool that provides visibility and more comprehensive visibility into a health system can be used in Sierra Leone and beyond. So first, I want to talk a little bit about why we developed this technology in Sierra Leone, because often we measure our health systems through surveys, and those are incredibly valuable. But oftentimes they take a long time to complete, and they're very expensive. And when you're in the middle of a pandemic, you need information at your fingertips that captures exactly what's going on in that health facility today with updates. And AI technology is able to help us do that. And that's what Striata has done in Sierra Leone. It has used over 600 data inputs and has created a visibility tool where governments can now see their health systems more clearly, more comprehensively. And then it uses predictive analytics to measure health facility readiness to respond to COVID-19. So this is what Striata actually looks like, the interface that the government of Sierra Leone has access to. And in the top right-hand corner, you'll see the COVID-19 readiness score, and the color denotes the readiness level that it is at. And then the COVID-19 readiness score is comprised of different components that are listed here below, such as infrastructure, human resources, materials, and supplies. And all of this, again, is what calculates this COVID-19 readiness score. And again, this is something that is updated in real time. It's continuously learning. And not only can the system predict a COVID-19 readiness score, but it can also predict certain line items. So the system is learning from all of the data that's coming in. And by learning about the environment of health facilities and districts, it can actually impute values into missing values or null values. And all predicted values are denoted with an asterisk. And again, talking about continuously learning systems, Macarize developed a web scraping tool that continuously scrapes the web to provide that real-time update. And we're also connected to certain government systems, such as DHIS2, that is updated on a monthly basis. And all of those insights can continuously update over time. Not only do we provide certain predictive analytics, but we also can tell health facilities and decision makers what needs to be improved in order to improve the COVID-19 readiness score. So there are certain features or variables that the system denotes as important for calculating the COVID-19 readiness score. And the system then can say, you either have these things and that's what you're doing well on, or you need these things to improve your COVID-19 readiness score. And here's just an example of what that looks like. And so again, at this particular health facility, they are in need of community health officers and also inpatient and maternal beds to improve their COVID-19 readiness score. So again, Striata is more than just looking at COVID-19. It's a health systems approach because it's looking at these different components that make up a health system. So again, it's helping to reduce uncertainty about what's inside each health facility in terms of staff or equipment or infrastructure, such as electricity or sanitation. It also helps decision makers deploy resources more efficiently because they can see what's inside those health facilities or what the needs of a district may be. And also, it can discover certain hotspots. Where are health facilities outperforming? And that can enable a proactive health system response that, X health facility actually really needs more resources because they're serving a larger percentage of the population. And that's okay because we can see it in the system. We can see that they're serving a larger catchment population area, and we can see that they're absorbing more resources over time. And that can also indicate that potentially a new health facility might need to be built in the area to also help balance the demand in that particular community. So again, Striata provides a lot of different types of insights, and I've gone over the COVID-19 readiness scores that really measures the capacity of that health facility to respond to COVID-19, how the system can predict certain individual line items, and those are listed here. So we can predict actually the total number of beds if that is not readily available. We were able to predict number of masks that were at certain health facilities in some human resources across Sierra Leone. We also use satellite imagery to look at weather patterns that affect access and also verifying certain health facility locations where geolocations were unknown. And also we've been able to identify some solar panels, which I'll talk about in a coming slide. And lastly, through the web scraper tool that I had mentioned, before the government of Sierra Leone was able to share where their COVID-19 labs were located, we were actually able to pull that information off of the public internet and put those geolocations in the interface. And here again on the right-hand side is just some more examples of how you can see information in the interface. You can hover over electricity or sanitation or water and see the type of electricity that is at that specific health facility. We're also looking at norms. So what are the norms at that health facility, and how does what they have compare to those norms that are defined through government policy documents? You also have the option to look at your health facility through a satellite imagery view. So again, just different options that are available based on the data that we're able to pull and the different insights that Striata can provide. Going back to our research done around satellite imagery, we're able to use low resolution satellite imagery and high resolution satellite imagery. Low resolution satellite imagery is readily available on the web, and we've been able to look at a specific health facility over time to see how weather patterns have changed and certain flooding that is more prone to happening around some health facilities than others. And this really will have implications when we start looking at disease burden and seasonality of malaria in some areas, and or dengue or Zika or whatever it may be. Why, again, explaining why certain disease burdens may be higher or certain access might not be available during certain times of the year. We were able to see on Twitter that a bridge had collapsed at this one health facility and triangulated it to these weather patterns. And again, there was a certain period of time that access to a health facility was not possible because of this. So again, bringing it back to understanding shocks in the system and how we can make health facilities more resilient, this kind of information is incredibly valuable. When we looked at high resolution satellite imagery, we were able to identify solar panels at specific health facilities. And those solar panels were really important because it is very likely now that we know that these health facilities have electrification. And that has implications for cold chain and distribution of COVID-19 vaccines. And what was interesting was that there was information about these health facilities that we were given from the government that was from 2017 that showed health facilities did not have electrification. But after this exercise, we were able to identify health facilities that did have electrification. And again, that was really important for them in terms of identifying possible cold chain sites. So again, this is just a very brief overview of Striata and what we were able to provide to the government of Sierra Leone, which was more visibility into their health system at a critical point in time and more understanding about what is needed and the capacity of their health facilities to respond to COVID-19. Again, this is just one example. Our work in Sierra Leone continues today. We are working hand in hand with the government on other use cases around optimizing human resources and also predicting better forecasts for essential medicines to reduce stockouts across the country. And so again, the work continues, and I really look forward to taking your questions in the Q&A session following this. So I welcome you now to join me there. Thank you.